Hello, everyone. It's the day after Labor Day in the United States, September 8th, and we're all supposed to be back at work after a weekend off. Today, I'm going to share an interview that I recorded last week with Mads Vittrup, who's a very interesting and charming fellow. But before we go to the interview with Mads, let's take a look at a couple of things that are occurring in our news today. You know, there are two really interesting stories, and I have to put in a plug for our print magazine. You know, we do these product showcases and industry sector reports. And in today, for those of you who don't receive the magazine, you can see a report we did on MRI, a product showcase for MRI. There's also a story about how to reduce anxiety for the patient in an MRI and how to make the MRI process more streamlined. And there's also a report on chillers, an interesting report on chillers. And like, no matter what happens, whether you're scanning or not, you have to have chilled water for your MRI and sometimes for your CT. So, and other healthcare devices. So here are two interesting reports and an interesting story that I hope that you'll take a look at in our online news. It's free, and if enough people don't go there, then somebody's going to shoot me. Okay, today we're joined by Mads Vittrup, who is the CEO of FlexRay Medical. Mads, it's so nice to see you. Thank you for joining us.
Thanks, Phil, and thanks for having me.
You know, I've known Mads a long time. He's a very knowledgeable guy, thinks fast on his feet. And Mads, how long have you been in the business? Help me.
I'm looking at 16 years, something like this. Yeah.
And when did you start? Were you just out of college?
Well, I was in college basically, and then supposed to have a break, and never got back into school, so to speak.
So Mads was always an innovative and knowledgeable guy on a wide range of topics. And he left the company that he worked for how many years ago, Mads?
Oh, about 6 years ago, 5.5, yeah.
Boy, time flies. And he started FlexRay Medical with a partner. And now you do business in the Middle East, in Eastern Europe, and in Africa. Is that correct?
Those would be our main markets. Yeah, that's correct.
Now, what's it like? How has it been more? I assume it's been more difficult to do business as a result of Corona in all markets.
Definitely, yes.
Tell me about that, if you would.
I mean, to say that it's been more difficult, it's been like, etc. I mean, it's been impossible to do business in many ways. I think if we look back on the second quarter from our side, I mean, there were basically no business. I spent the majority of my time playing golf because there was absolutely nothing we could do. So that was a stressful days, I would say. I mean, just burning money day by day. The problem was really that even in countries where there were markets and activity going on, clients were unable to buy anything because their banks was holding back financing and so on, even though it was pre-agreed, because the bank was nervous about what's going to happen in a month from now or 2 months. They had no idea. At that period of time, I mean, we didn't know if this was just a virus or the Black Death, so to speak. I mean, exaggerating a bit. So people were very, very nervous of investing in anything. So that took some time.
You know, I forgot to mention that Mads is in Denmark, and your company, FlexRay Medical, is based in Denmark.
We're based in Aalborg, also referred to as the Medical Valley of Northern Europe.
And you also have a service team in Egypt. Does that service team also service the Middle East and Africa and Eastern Europe, or just
no,
Africa?
This is solely for at this point anyway. It's solely been for African markets.
Now, we talked a little bit, and you're involved in high-end diagnostic imaging equipment such as CT and MRI. What about helium prices. What are helium prices in Europe, in Africa, and so forth? Tell me about that.
Well, they are high, to say it short. I mean, today we're about double prices where we were a year ago in Europe. You go to Africa, it's, well, double again. So I think now in Europe we're around 18 euros or something like this, which is significantly higher than it used to be. Not as scarce a commodity as it was a few months back, but that comes and goes depending on the supply, of course.
And Africa is can push €37 a liter.
Definitely, yes. I would like to add to that, though, that from my perspective, I mean, we try to convince our African clients not to go for high field magnets because the infrastructure surrounding the cooling chain simply gets I wouldn't say too complicated, but it's very fragile in terms of the power connections in Southern Africa. So it's difficult to service basically in a healthy way. So we try to convince people to go for more economic systems, more safer systems like permanent magnets, for instance. This based on the local infrastructure, it's a better solution simply.
Now, speaking of service, during the coronavirus, if one of your machines went down, it was just impossible for you to send someone. Is that correct?
In most cases, yes. Because again, you cannot get engineers on a plane to get out of country A to country B. There's nothing you can do. And as we are a small company doing business in multiple countries, everything is about transportation and getting across borders. And for a long period of time, it was almost impossible. And I say even today, with when flights are getting back into the air, there are still so few connections that it still makes things difficult in terms of that.
Right. Now, we would always meet each other at various trade shows. What do you think about the future of trade shows?
I mean, I think today I'm very happy that I have not invested in a trade show company, put it that way. I think the Corona thing have changed and will change for the future, the way business is being conducted. I think a lot of us who used to go to these 6, 7, 8, whatever different kind of shows per year and plan our year around those, I think this year we have learned how much we're really getting from those shows. I think today much more is online and it's much more transparent online who's who and who's actually where. I think a lesson learned from Corona could be that we don't need the trade show to the same extent as we used to, at least not in the dealing kind of business.
How about the coronavirus and how are conditions there in Aalborg? What's it like? Are people social distancing? Is the death rate up or down? The infection rate? How about it?
Well, I mean, Denmark was quite early in this process. So we were closed down in early March. And of course, the first period of time, in our case, about a month, up until around Easter, it was more or less a complete lockdown. And we were all working from home, feeling like Robinson Crusoe, basically. But at this time now, our opening process has been going on now since Easter. And now we are almost back to normal. Big gatherings, big crowds is a no-go, of course. Cinemas and so on is closed, but you can go out, restaurants are open, and so on. Traffic is back to normal, unfortunately. But as it is today, I don't see the much big difference anymore. Of course, people are still keeping, to some extent, having a social distance, but not as much, unfortunately, as in the beginning. For the same reason, we also see a slight increase in the number of infections. It's not high in Denmark. I mean, we're a country of about 6 million people, and we have about 100 new infections per day, which is not a whole lot considering how open the society is now. And I checked this morning, actually, and today we had 2 patients in intensive care because of Corona. So that's nothing really.
Right.
So to a far
Unless
extent,
unless you're one of those two patients.
then you are in trouble. Unfortunately, yes. But no, seriously speaking, I think it would be fair to say that Denmark as a country, we got off quite easily on the corona. We had a very quick lockdown, which it seems to be a good idea.
Now, in the United States, hospital revenues are down tremendously,
Mm.
which means that hospitals are not buying new machines,
Mm.
which means that there are no used machines,
Mm.
as there are fewer used machines for sale.
Yeah.
This is an existential problem for a company in the United States in the used pre-owned space.
Mm.
What about in Europe?
I think this really depends on what market you look at, because to a far extent, the European market is dominated by socialized healthcare, meaning the government runs the hospitals and pay for the equipment. So in that sense, of course, the equipment was supposed to be replaced during the spring. In most cases, were not replaced, but was postponed, the replacement. So in our case, for instance, we had a long range of equipment was supposed to come out in April, May, June, which didn't because the hospitals were closed down, so to speak. But instead, now it's pushed to the fall. So now a lot of equipment will be coming out now when things are reopening. And again, then we see different things, because if you look at the MRI market, that's definitely in a tough spot right now, because less people are going into that level of investment at the moment. On the other hand, CT prices right now are high because many countries around the world, including the US, suddenly have a much higher request for CTs than before, also because of corona screening programs and so on.
Right.
So, I mean, you lose some here, you win some there, it all adds up in the end. So I think business-wise, I don't see a huge negative impact on our end. I really don't.
So you're optimistic about the future?
I am. I mean, at the end of the day, we are still operating within the healthcare field, and there will continue to be a demand for price-effective solutions, especially in developing markets. There's huge demand still. I think on a weekly basis, I get 20, 30 requests from individual doctors who want to have a turnkey solution.
Well, I hope you're right.
Me too.
Well, Mads, it's always nice to talk to you. I'm sorry that we don't get to meet each other in person, but I look forward to the day that we can. And thank you very much for joining.
Appreciate it, Tom. Have a good day, and thank you.